Have you ever felt a constant, nagging pain in your lower abdomen that just wouldn't go away? That, dear viewer, could be chronic pelvic pain. This isn't your ordinary stomachache. It's a persistent discomfort that lurks in the region below your belly button and between your hips. It's not picky either. It afflicts both men and women, often without discrimination. You'd think such a common issue would be well understood, right? Unfortunately, that's not the case. Chronic pelvic pain is often overlooked, misdiagnosed, or even dismissed as just a part of life. But let's set the record straight. It's far more than just a minor annoyance. It's a complex condition that can significantly impact your quality of life, making even the simplest daily tasks a challenge. Chronic pelvic pain is more than just a pain in the belly. It's a complex condition that requires attention and understanding. So, what exactly causes this persistent pain in the pelvis? Let's delve into that. Often, chronic pelvic pain springs from various conditions, each with its unique complexities. One of these conditions is endometriosis, a disorder where tissue similar to the lining inside the uterus begins to grow outside it. This misplaced tissue can cause severe pain and fertility issues. Another common cause is interstitial cystitis, also known as painful bladder syndrome. This chronic condition is characterized by bladder pressure, bladder pain, and sometimes pelvic pain, ranging from mild discomfort to severe pain. Pelvic inflammatory disease, caused by a sexually transmitted infection, can also result in chronic pelvic pain. It's an inflammation of the female reproductive organs that can lead to scarring and infertility if left untreated. Irritable bowel syndrome, a common disorder affecting the large intestine, can also lead to chronic pelvic pain. Symptoms include cramping, abdominal pain, bloating, gas, and diarrhea or constipation, or both. It's important to note that sometimes, despite the best efforts of medical professionals, the cause of chronic pelvic pain remains a mystery. This unknown factor can make diagnosing and treating the condition a challenge, as doctors must often rely on the process of elimination to rule out possible causes. This is not an exhaustive list of conditions that can lead to chronic pelvic pain, but it does illustrate the complexity of the issue. Other potential causes include chronic pelvic pain syndrome, fibroids, pelvic congestion syndrome, and even psychological factors such as stress or depression. Each individual's experience with chronic pelvic pain is unique, influenced by a variety of factors including their overall health, lifestyle, and even genetic predisposition. This diversity of potential causes makes it crucial for individuals experiencing persistent pelvic pain to seek professional medical advice. In conclusion, chronic pelvic pain can be a complex and multifaceted issue with a wide array of potential causes. Understanding these causes is a key step towards effective diagnosis and treatment. As you can see, the causes of chronic pelvic pain are numerous and varied, further complicating its diagnosis and treatment. Now that we know what can cause chronic pelvic pain, what are the signs and symptoms to look out for? Let's delve into this. The symptoms of chronic pelvic pain are as diverse as the causes. They can range from a constant, dull ache to sharp, stabbing sensations. For some individuals, the pain is a constant companion, while for others, it comes and goes. The severity of the pain also varies, from mild discomfort that's merely annoying to a severe pain that can be debilitating. It's not only about the pain, though. Chronic pelvic pain can also manifest itself in more specific ways. For instance, some people experience pain during intercourse, a symptom known as dyspareunia. Others might feel pain while urinating or during bowel movements. But the impact of chronic pelvic pain isn't limited to physical discomfort. It can also spill over into other aspects of an individual's life, affecting their mental and emotional well-being. The persistent pain and discomfort can lead to feelings of frustration and helplessness, contributing to symptoms of depression. It can also interfere with sleep, leading to fatigue and a reduction in overall energy levels. Physical activity can also be affected. The pain might make it challenging to maintain an active lifestyle, and as a result, individuals may find themselves becoming less physically active. This decrease in activity can have a ripple effect, leading to further health issues like weight gain or muscle weakness. In women, chronic pelvic pain may also be associated with their menstrual cycle. Some women might experience increased pain during their period, while others may notice a change in their menstrual flow or cycle length. It's important to note that these symptoms can vary greatly from person to person. What's common, though, is the significant impact they can have on an individual's daily life. This makes it absolutely crucial for anyone experiencing these symptoms to seek medical help. These symptoms can severely affect one's daily life, making it crucial to seek medical help. Remember, early detection and intervention are key to managing chronic pelvic pain effectively. Recognizing the symptoms is the first step, but how do doctors diagnose chronic pelvic pain? When it comes to diagnosing chronic pelvic pain, healthcare professionals employ a multifaceted approach. This process is comprehensive, as it is crucial to pinpoint the exact cause of the pain, which can be elusive due to the complex nature of the pelvic region. The first step in the diagnostic process is a detailed review of the patient's medical history. This includes any past surgeries, illnesses, or injuries, as well as lifestyle habits and the characteristics of the pain itself. The doctor will ask about the duration, intensity, and location of the pain, and whether certain activities, movements, or times of day exacerbate it. Next comes the physical examination. Here, the doctor will carefully assess the pelvic area to identify any abnormalities or possible sources of the pain. This may involve a pelvic exam for women or a rectal exam for men. To further investigate, doctors may order certain tests. A pelvic ultrasound utilizes sound waves to create images of the structures within the pelvic region, helping to detect abnormalities such as cysts or fibroids. A laparoscopy, on the other hand, is a minimally invasive surgical procedure that allows the doctor to visually inspect the pelvic organs. This can be particularly helpful in identifying conditions such as endometriosis or pelvic inflammatory disease. Finally, a cystoscopy can be performed to examine the bladder and urethra, which can be the source of pelvic pain in some cases. Throughout this entire process, clear communication is critical. Patients should feel comfortable discussing their symptoms openly and in detail. Doctors, in turn, should provide clear explanations and foster an environment where patients can ask questions freely. Diagnosing chronic pelvic pain can be a complex process, but it's a crucial one. It's only through a thorough diagnosis that a targeted and effective treatment plan can be established. So if you're experiencing symptoms, don't hesitate to reach out to a healthcare professional. A thorough diagnosis is the key to a successful treatment plan. Now, on to the most important part. How can chronic pelvic pain be treated? Chronic pelvic pain is a complex condition, and its treatment options are as varied as its causes. The first step often involves medication. Over-the-counter pain relievers like ibuprofen can provide short-term relief, and prescription drugs like antidepressants or anticonvulsants can help manage chronic pain. But medication is only part of the solution. Physiotherapy can play a crucial role in managing chronic pelvic pain. A physiotherapist can provide exercises to strengthen the pelvic floor muscles, which can help alleviate pain. Techniques like heat and cold therapy, ultrasound, and electrical stimulation may also be part of a physiotherapy treatment plan. Now, let's not forget the role of mental health in managing chronic pain. Counseling can be a valuable tool in this journey. It helps individuals understand and cope with their pain, reducing stress, anxiety, and depression that can often accompany chronic conditions. Cognitive behavioral therapy, in particular, can help change the perception and impact of pain on quality of life. In some cases, when other options have not provided relief, surgery might be considered. This could involve procedures to remove scar tissue, treat endometriosis, or address other underlying issues causing the pain. However, surgery is generally seen as a last resort due to its potential risks and complications. The key takeaway here is that treatment for chronic pelvic pain is highly individualized. What works for one person may not work for another. It often involves a combination of treatments and requires patience and persistence. Working closely with healthcare providers to create and adjust treatment plans is essential. Remember, there's always hope. With the right treatment, chronic pelvic pain can be managed effectively. So don't lose heart. Keep exploring options, keep communicating with your healthcare team, and most importantly, keep believing in your capacity to reclaim your health and well-being. So that's a wrap on our deep dive into chronic pelvic pain. Remember, you're not alone in this journey. We've taken a comprehensive look at the causes, symptoms, diagnosis, and treatment options for this condition. But the most important takeaway is this: don't hesitate to seek medical help. Open communication with healthcare professionals can make a world of difference. Now, let's make this not just about learning, but about sharing. Maybe you've got a question that didn't get answered. Perhaps you've got a personal story that could offer hope to someone else. Or maybe you've got a suggestion for future topics. Whatever it is, don't keep it to yourself. Your feedback drives this channel forward. Whether it's a suggestion, a personal story, or just a simple hello, I'd love to see your comments below. Your interaction makes this community stronger and helps us all learn from each other. Don't be shy, join the conversation. Also, if you enjoyed this video and got any value from it, please like and subscribe for more quality content. Thank you.